Good day, Mr. Joe. I'm Rocky, your CNA for today, and I will give you today mouth care. Is that okay with you? Okay, now I will adjust your bed into a sitting position, okay? We need to adjust the bed before we start. The resident should be in a sitting position to make him comfortable while we are giving oral care. Gently, after we adjust it, we need to make sure that the wheels are locked to avoid the bed from moving. So good. Are you okay, Mr. Joe? Are you comfortable? Okay, I'm gonna wash my hands now and I'll gather my supplies, okay? Now, after we wash our hands, which is very important, now we need to provide the following. In our supply table, we need to cover it with a barrier to provide a clean surface for our supplies. And then, we need to provide the following. A towel, a basin, a toothpaste and a toothbrush, of course a cup of water, and a set of gloves. Mr. George, is it okay if I put the towel on your chest? Okay. Put it nicely. Now this towel will serve as a protective clothing for the resident to avoid him from getting wet. Now, after this, we put on our gloves. Nicely. And then the toothbrush, we're gonna soak it a little in the water, and then we apply a little toothpaste. Okay. Okay. Now, Mr. Joe, can you wide it open? Can you wide up your mouth, please? Open it, please. No. And then after the resident opens his mouth, we will start with the surface of the teeth, starting from top to bottom. Top first. Top teeth lines, of course the gum lines, and the back of that teeth line, the back side of that upper teeth line, and then the same goes to the bottom line, bottom teeth lines. Okay, the surface first, sides, the back side of that teeth line, of course don't forget the gum lines, and then bring the teeth together and brush it together like that, as well as the tongue. Ask the resident to put out his tongue and brush it as well, gently. All strokes must be gently. Okay, and we'll start it. Mr. George, I can take a sip. Please rinse your mouth. I'll spit it out. Would you like another rinse? No? Now we're gonna dry the resident's mouth with a towel, gently. And this towel will go straight to the dirty linen. Now we need to dispose of the things that we use. Okay? Now, some facilities, most of the facilities are using disposable toothbrush. If they are using disposable toothbrush, no problem. We just need to throw it right away. But if not, we need to rinse this. We need to rinse it well, along with the basin. Okay. And the cup. We go to the trash as well. Okay. Now first we rinse the basin. Towel. Wipe it from the inside. Discard. Another one. From the outside. Another one. Another one for the drawer store. Okay. Along the way, we'll take our toothpaste. And we'll store it properly. You put towels on the trash, as well as the chucks, the barrier we prepare. Or trash as well. Now, I will remove my gloves. Throw it as well. Set aside the table. Now, if the resident wants to stay in this position, let him be. But as much as possible, we put it back in its original position, the lying position. That's all good. Okay. Are you okay, Mr. Joe? Do you need anything while I'm still here? Are you comfortable? Okay. Here's your call light. If you need anything, don't hesitate to call us, okay? Okay. Now, after we give oral care for the resident and we make him comfortable, I will document my procedure, take notes and documents also, all the observations and changes that I notice in the resident and how you give the resident an oral care.